Good afternoon, everybody. Thank you for joining us today, and thank you for being here as we kick off our Spring 2021 webinar series. We'll be talking about COVID-19 and the food system this spring in 3 separate webinars, trying to really understand the impacts and explore solutions. Our speaker today is Darren Chapman, with our very own Interdisciplinary Center for Food Security. He'll be talking about emerging issues in emergency food. That's a little bit of a tongue twister, Darren. Yeah, we're very happy to have him. We have just a short intro before we turn it over to Darren. And so with that, I want to turn it over to Mary Hendrickson.
Thank you, Bill. And I'd like to welcome everybody to the webinar, the first one of the spring semester from the Interdisciplinary Center for Food Security. We are dedicated to research, teaching, and outreach at the intersection of food security and food systems. We're really trying to understand what's happening with the causes and consequences of hunger and building food secure communities.
And I'm Bill McKelvey, also with the Center for Food Security, but I also have a part with our other event sponsor, the Community and Economic Development Food Systems team that is part of MU Extension. And so this is a team that gets together and works on a variety of projects that really center on community engagement and helping communities have the tools and the resources and the processes that they need in order to build healthy and resilient and equitable food systems. And very briefly, before I turn it over to Dr. Chapman, our format today will include about 30 minutes of hearing from Darren, and then we've reserved the rest of the time for Q&A and discussion. And so this is really a time to use the chat feature to put your questions in the chat, or by all means, we encourage folks to also unmute yourself and go ahead and speak your question, whichever you feel comfortable with. So, and just so you know, these webinars are all recorded and eventually posted on our website at foodsecurity.missouri.edu. There's a webinar series tab at the top of our homepage. You should be able to navigate to this pretty easily. So with that, I'm going to turn it over to Darren and let him take it from here.
All right, thank you, Bill. Let me just figure out the controls on my computer. Well, welcome everyone. I know there are a lot of things we could be doing at a 3:30 on an afternoon during COVID time when there always seems to be time to work, but I appreciate you all being here and giving up your time to join us in this conversation. I will say that I do want it to be a conversation, and I hope we have a good amount of conversation that comes out of it. So I'll try to get as close to 30 minutes, maybe under, with this, and leave as much time as we can for that conversation and dialogue at the end. But as Bill mentioned today, I'm going to be talking about some emerging issues in the emergency food system. And for that, I'm going to go through a brief introduction and then start talking about food pantry operations, because food pantries are going to be kind of the center of what we're discussing today. And then a little bit more broadly, the emergency food system as a whole. And then we'll get into some COVID-19 response, looking at a few different studies that we've done with the center, a qualitative study, a small survey that we did, and then also some pulse data that we've been getting and information that we've been getting from Feeding Missouri related to COVID-19 response. And then going into a little bit of discussion implications, and then moving on into those questions and comments that you all have. So time for an introduction, just diving right on in. So despite an abundance and general affordability of food in the United States, there is this situation of need among plenty, as it has been coined by some, with 11.5% of the US households facing food insecurity. So there's some uncertainty going on as far as where their food is coming from, or they don't have access to enough of their desired food options to meet their household food needs. Within that 11.5%, 4.9% of households face food insecurity with hunger or very low food insecurity. So they're seeing this change in dietary intake because of a lack of means to purchase or acquire food. So I will note that within that, that is through typical means. So when we start talking about food pantry utilization, what's interesting is based upon that definition, anyone using a food pantry is food insecure. But that isn't how it always fits into those numbers. So there, it's just something to keep in mind when we start talking about anyone utilizing food pantries. So historically in the US, we've addressed hunger through the implementation of publicly funded programs. This started in the Great Depression through the purchase of agricultural commodities and their redistribution of them. And this has been in part led to the creation of food stamps, now known as SNAP, WIC programs, TANF, and CSFP, which is your Commodity Senior Food Program. So these publicly funded responses to hunger have largely followed national economic and political trends. Food stamps were developed during the Great Depression, reinstituted with JFK during his presidency, and greatly expanded with Johnson's War on Poverty. However, we've actually seen a growth of private response to hunger with the growth of neoliberalism and the emphasis on the decentralization of services away from the federal government. And so what we see is this rise of private hunger response. The first food pantry was actually established in 1967 in Phoenix, Arizona. And this model has spread with the creation of Second Harvest, which has now become Feeding America, to include over 200 food banks currently, and serving over 46 million unique clients each year. This saw an 81% increase from 1997 to 2017, with food pantries actually providing an increasing role. And within this, we are actually seeing that it isn't just economic downturns where we're seeing the use of food pantries going up, but actually that they are sustaining over time, and they're becoming a more centralized fixture within meeting the food needs of households that are facing food insecurity in the United States. This graph right here shows once again that it wasn't just a downturn at the end of the recession, but the utilization of food pantries actually continued to increase until roughly 2016. So you saw, another 7 years of increase following the stabilization of the market, which we would have hopefully assumed would lead to greater levels of food security. So food pantries are largely dependent upon the charity model. And what this leads to is food pantries and food pantry clients often being at the mercy of donations in regard to the health, quality, and availability, with many users reporting in the past deficient or undesirable food options. These two pictures here are actually at a food pantry in Missouri in consecutive months. The one cart being the food donations that came in 1 month during the summer, and the next month when pantry clients went back, this is what they received. So there's a very stark contrast here between the types of foods that you're actually getting, even at the same pantry within a very short time frame. And so what we're seeing is there's also some health disparities that exist among pantry clients. Pantry users often face increased prevalence of BMIs and obesity range, diabetes, high blood pressure, high cholesterol, all these negative health effects related to dietary consumption. And so with these negative effects, we often start seeing like, why is critical evaluation often slow when it comes to food pantries? And Janet Poppendieck identified this as a halo effect. Because of the charitable nature, this idea that any food is better than no food, really leads us to call into question how able we are to critically evaluate these types of charitable programs. And that's something our center is really trying to work on and really engage with these systems and better understand them and help them kind of pivot in the ways that they can meet the needs of their clients while also addressing some inequalities that exist within this system and really become a more complete hunger alleviation opportunity or structure here in the United States. And so we need to start looking at the type of operations we have. And all of this data right here came from my dissertation, which was a statewide study of food pantries, and really creating this model, this understanding of what food pantries look like here in Missouri. And food pantries were open an average of 8 days a month or 36 hours. I will note that the majority of pantries are actually open 1 day or fewer a week. And this is really kind of boosted by a few pantries that are open 5 to 6 days a week for 8 hours at a time, similar to those like Central Pantry there in Columbia. But we do have an average of 9 days a week. The average number of households served by each pantry is 271. And in 2019, 44.4% of pantries were serving more individuals than they had the previous year. We'll talk a little bit more about this trend later on in this presentation as well. 61.1% have no paid staff. And of those that do have paid staff, the majority have 5 or fewer paid staff on their pantry board or kind of governing body. And most of them rely on volunteers to do the majority of their work, with average monthly volunteers being about 33 people that are coming in to help with pantry services. 68.8% are religiously affiliated, often working out of churches or through religious organizations or partnerships within communities. The majority of pantries are fully accessible and provide provisions at least once a month. So pantry clients can go get food from them once a month with the presentation of required documentation. So when it comes to actual distribution, the most common model follows the stereotypical food box model, where you go and you receive a predetermined package selection of food. And the majority of food handling is actually done by volunteers and staff. So there has traditionally been this separation of food. And so you have the pantry client and the food giver. And it's this really stark contrast between kind of the providers of the food and receivers. There isn't that opportunity for engagement with the food that we would typically experience, say, if we were going to the supermarket to purchase food. So it is this very unique model when it comes to engagement or procurement of food within the context of the United States. So most commonly, food pantry directors are white, Christian female, with a high school diploma or higher. And what is really interesting is most of them don't identify or don't have a lot of experiences similar to the clients that are coming to the food pantries. So most identify as financially secure and stable individuals growing up in financially secure environments and often having never utilized food pantry services. So once again, there's this disconnect or this place that could be really a space for not really understanding what food pantry utilization could look like from the user endpoint. We have this very much a top-down approach from food selection, distribution, food handling to the clients coming in. And we've often talked about on our team when within food justice work, of how do we change this model and create a client-driven model? And what we're seeing that it's really hard to do, given the prevalence of these this disconnect in the system that's in place. But food pantries also aren't operating just food distributions. They're offering a range of services. Here in Missouri, we actually see food pantries providing services from all of these categories. However, when it comes to identifying which ones are most important, food pantry directors see organizational structuring and direct food provisions as the most important aspects of their operations. So how do they set up their space to make it accessible and meet their needs? And then moving on, how do we get food directly to that individual? Last on that are systemic supports and other food supports, which would be larger systemic issues. So how do we address issues of poverty that are actually causing hunger? And food pantry directors often don't see these as important to the work that they're doing or the work of their organization. So we're starting to, as we get an understanding of what pantries are doing, kind of the thoughts that their directors have, we have this insight into how change could possibly occur. And our team has been working on this in a number of ways, and then COVID-19 hit. And COVID-19 has really thrown a wrench in everything we do, whether it be our day-to-day lives, our work environments. It's also thrown emergency food and food pantry utilization kind of for a loop. At the beginning of the pandemic, if you think back, you may have seen a lot of news articles about food pantry lines just extending for miles. And this picture here is actually a picture of a food pantry distribution in Michigan. And what we're seeing is there was this big reliance on this big need as individuals were furloughed, they were laid off, they couldn't get into places to apply for SNAP benefits. But we'll also start discussing here in just a second, maybe why you started seeing more people in these lines that hadn't been there before as well. And so we see COVID-19 placing a huge stress on food pantries. And what happened with that stress? Food pantries are places of contact. They are places where there was a lot of engagement going in. And what we actually found when we started talking with food pantry directors, surveying them, having focus groups, is that the majority of them stayed open. And they stayed open because there is this key motivator, a key kind of desire to meet need in their communities. One pantry director in one of our focus groups says, you don't want to be closed down for too long because these people need food. They saw it as really their duty to their community to stay open. Because if they weren't open, people weren't going to be able to get food. So they were willing to make sacrifices to meet that need. And they really see it as a key and central part of who they are as an individual and really their purpose. There's a lot of past educators, past social workers that are filling some of these volunteer roles when it comes to pantry directors, and they're willing to do whatever it takes. And some of them have taken on a really increased mental toll during the pandemic. One individual noted that they really take time to listen to everyone that comes in and talk at the food pantry. They soak in that situation and so forth. And so it's this entire situation, the responsibility that lies on me as the one responsible for everyone that comes in. They're seeing it as that sole responsibility to feed their communities. And we just keep going because, because that's the responsibility to serve others. And we did these focus groups earlier in the summer, and the data has shown that they're still largely staying open. 5 to 10% of pantries are still closed as of December 2020, with a Feeding Missouri Pulse data that we have received, which is concerning for them, seeing that we are this far into the pandemic. And the majority of the pantries that are still closed are actually closed due to safety concerns for volunteers. We mentioned earlier that the majority of pantries were operated solely by volunteers. And I should also note that the majority of those volunteers are older individuals, retired and individuals who are much higher risk, given the data that we had about COVID-19 for contracting COVID-19 and also seeing increased or having worse experiences with COVID-19. And so we still have 5 to 10% of pantries that are closed within our food bank regions. And the majority have also transitioned their services. They closed down allowing clients into their food pantries. They started limiting the number of volunteers that they could have at one time, and moved to a drive-through model where individuals come, stay in their cars the entire time, go through whatever sign-in procedure that they have, open their trunks, or have people load things into the back of their car to decrease personal contact and have less close contacts while utilizing the food pantry. Many are also offering fewer additional services. Like I showed earlier, food pantries don't just deliver food, but they were providing a lot more resources within their communities, whether that be from health screenings to helping with food or SNAP benefits and cooking classes, things of that nature. They aren't doing those anymore. And they're simply relying on that distribution of food. Many are also relying on key and core volunteers, but also some new volunteers, specifically in the way of the National Guard. Missouri has actually deployed the National Guard to assist with food banks and food pantry distributions. And I believe we were told that they're going to be in place until April of this year at minimum, which is great when you start thinking about the opportunity that rests there when it comes to moving food boxes and not relying on older individuals who are volunteering at pantries to do that. We've also seen a number of increased food requests. So more clients are needing assistance. These initially took off, but have largely leveled off thanks to some of our public assistance programs with the increase of unemployment benefits and some of the pay disbursements for COVID relief. But food pantries are noting a lot of increase in first-time pantry users, even when it started to level off. And a lot of them talked about this happening in these suburban areas where you have a lot of middle income families who really saw layoffs and may have had a harder time paying some like debts when it comes to credit card or vehicle payments, house payments, and really food kind of became that last priority in trying to make all of the bills. And the pantries that actually reported the highest increases were in those areas that weren't used to pantry utilization more generally before the pandemic. So not only have services transitioned, food pantries have also taken on new roles. It wasn't just businesses that were closing down. A lot of government agencies shut down. And so we've had food pantry directors also indicate that because of the trust that they have in their communities, clients were coming to them seeking help for things that were previously done by caseworkers within their rural communities. But because those offices were closed, no one was there to answer phones. Clients were coming up to them and asking them to help them figure out what was going on with their insurance. How can they make sure that they're enrolled and really helping with any issues? Not only that, but some directors also identified that their clients were coming to them to help them ensure that their banking systems were set up. With some of the older individuals and older clients that they had coming in, who were used to going inside, doing a lot of their business face-to-face. They didn't have a lot of experience when it came to technology and banking and making sure their payments were going through. But COVID has really changed the way in which they were able to make those payments, and they had to adapt. And the people that they went to were some of these pantry directors that they they trusted, and they were the only ones available in the communities to actually help them with the extended needs that they have. And so food pantry directors are really happy to be able to provide that role, even though it's taken a huge emotional toll on some of them. I know a lot of them also indicated they don't provide a lot of time for self-care, even with all these additional stresses. Some have even mentioned in focus groups increased drinking habits to kind of find ways to cope with this. But they also have concerns moving forward that are kind of playing into these stresses that they have within the current moment. As they're relying on fewer volunteers, those core volunteers are getting burned out. They're getting burned out. And they don't really care about how much they're pushing themselves at times, but they do care about those other folks. And the more work that you're doing with less volunteers, there is still the pre-existing health conditions that put people at higher risk that they rely on. And really, how do we have a sustainable program when there's still these concerns when it comes to COVID-19, but also long-term? What's the handoff that can be in place to ensure that as people age out or aren't able to participate in these volunteer services anymore, that food can still be distributed through this model? And they're also reporting a loss of volunteers because of health concerns. One Pantry identified that they lost 30% of their volunteer workforce, and in a survey of food pantry directors, over half reported a decrease in volunteers overall. And so when that is your main source of workforce within this organizational structure, that is really concerning. So moving beyond some of those concerns, which we can talk about in that discussion, many have seen consistent or increased food donations, which is a positive, but many are concerned with this moving forward. They are thinking, how long can this sustain? How are we going to be able to ensure that we have food moving forward? Because if there are economic issues moving forward, how likely are cash donations, or how likely are organizations willing to donate through their existing channels, and how likely are they to find ways to still profit off of what has traditionally been donated? So many are preparing for future or anticipated shortages by stockpiling during this time. They're taking as many distributions as they can, especially shelf-stable ones, and finding ways to store it and keep it for a later distribution date. Many also reported buying new refrigeration and freezer storage just to ensure that they can take in more of those donations that are coming in at this time, with increased program like I believe it's Farmers to Families with produce boxes and other types of things that they could potentially freeze and store and distribute later on. And not only have those food donations increased, but they've also seen similar increases in cash donations, with those actually being just a tad higher. And within COVID-19 response, regional and local support has been varied. The 6 regional food banks have all taken different approaches to providing insight and input into how pantries can and should respond, and have left it largely up to the pantries to identify their procedures, if there was anyone that tested positive, and reaching out to those health departments, who once again have very varied engagement and recommendations across the state. So we see this patchwork of understanding, patchwork of approaches that really leads to a lot of certainty among food pantry directors at times. And in our conversations with them, that leads to a lot of kind of angst, a lot of uncertainty, and really wishing they just had some oversight that gave them clear direction in what to do. And some of that is really kind of an issue of the structural things that are going on within emergency foods. So we see emergency foods as a really large system. You have Feeding America at the national level. You have state organizations like Feeding Missouri, the regional food banks, who are all fairly well connected, fairly well funded. But when you get to the individual level, the community level, a lot of these food pantries are independently operating, very loosely connected back to these other organizations. And there isn't a lot of cohesion when it comes to food pantry directors. And a lot of them mentioned that they really wish there was an opportunity for discussion, engagement, idea sharing, and really just an opportunity to feel like you're a part of something, to vent at times. Some of them wish they just had someone to talk to that understood and used our focus groups as that opportunity and saw it as cathartic at times. But we're seeing these structural issues, organizational issues, really posing some uncertainty moving forward for food pantries. But it's still really important to note that food pantries do play a critical role in our communities. This is highlighted through COVID-19, and I don't think the role that they play is going to decrease anytime soon. But the role they play and the capacity that they have varies very widely from community to community based upon the resources that they have to operate and really the spaces that they can provide services. So thinking about moving forward implications, we have this growing food pantry utilization with COVID-19. There's an increased visibility of this, and we really have this opportunity to start evaluating what Andrew Fisher says is this safety net under a shredded safety net when it comes to private food assistance and frontline response. So we really have this opportunity to start engaging in conversation, engaging in dialogue about what could this look like moving forward? How do we use this as an opportunity to highlight the strengths of food pantries and highlight the roles that they play in our communities, but also, once again, seek to pivot and really use this opportunity to increase the reach of food pantries in these communities. So food banks in Missouri are reporting an increase of 40% in clients needing food assistance at partner locations. Once again, there's an influx of new clients, and whether this continues or not, we are still waiting to get that data in. But there is that concern of volunteers and what happens when added supports leave, like the National Guard. What's going to happen to those pantry operations when they are having to fall back on those volunteers who are burning out because of the increased burden put on them? And what will food pantry utilization look like moving forward? Will it follow that increased trend following the Great Recession that we saw? And really, these are some larger questions that we don't have answers to yet and really won't until afterwards, but things that we have to prepare for if we're going to use this resource to its best capabilities to meet food need, not only in our state, but across the United States. So with that, thank you for your time, and I want to open it up to some conversation.
Excellent. Very nice job, Darren. Thank you for that. We do have one question in the chat waiting for you. And by all means, folks, go ahead and put some questions in the chat. And this really is meant to be a discussion. So if you have something to contribute to a question, then we're very interested in hearing from you. So Darren, this first question, what role do you see for local state agencies to work to address these COVID-related barriers in technology and navigation of the social services and food program systems to take the pressure off of food pantries dealing with these repercussions?
Yeah, I think that's a really great question. And I think it really highlights one of the issues is that food pantries are taking on a lot more without some of those supports and without some of the training. I will say it is concerning for me, in that one of the pantry directors that I was talking to that was helping with banking information, this is um, not someone who's formally trained in social services or anything like that, but who is being given banking account information to a client. So we're seeing some situations where food pantry clients are taking on maybe some increased risk in providing this information when there aren't systems of protection in place. And so it really comes to how do we start looking at engaging long-term, and this idea of technology is really hard. We have rural communities who have a lack of access to decent internet service. We have a lot of pantries who have a hard time getting internet service. And if you're going to rely on technology as a way of navigating these programs, you have to meet people where they're at. And that could vary widely. And so I don't know that there's a huge answer or an overarching answer that I can provide, but I do think there's a lot of really neat things on the horizon. I was talking to one pantry director who's currently building out their food pantry in Jefferson City, Missouri, who is going to start working in online food ordering into their pantry services, which I think is just phenomenal when it comes to being able to meet people where they're at. A lot of food pantry clients work multiple jobs. They are the working poor. They don't have time to often come during set times when food pantries are open. And so starting to think about how do we use technology to increase the breadth of our services to meet them where they're at. And so they're partnering with a food ordering system who is looking to get into emergency food work and have them be able to order from what the pantry has available and then do deliveries. And right now, they focus mainly on delivering to homebound seniors in their community, and are going to continue to work with that population, but extend it also to the community at large. So I think that creative utilization of technology, as we get more and more accustomed to ordering things through smartphone apps, I think those things can be applied to pantry services. But we're going to have to get creative when we start thinking about the technological gap when it comes to our rural communities.
Thank you for that. I want to pause. We have a couple more questions coming in, and some of them are related to technology. Did anybody want to speak a question? And then we'll go back to the chat.
Joe Hickey, I think you were trying to type a question. I didn't know.
Yeah. I wound up sending it to Bill, but I would be interested in knowing what technologies are out there for pantries that use client choice. We are using a Google Doc that is very labor intensive and would love to streamline our processes.
Yeah, that would be really labor intensive, and I would open that up to anyone that's practicing it. I can put people in contact with the food pantry that I just talked about, and they haven't rolled it out yet. They're still working. It's kind of they're beta testing the app essentially, but it is hoping to use technology in a way that streamlines it for individuals, because the Google Doc just that labor intensive makes it really difficult for individuals. And I know that there are people working on those things, but I don't know that I have all the best answers to that.
I've also come across a couple of examples. I'd have to dig through my notes to find out what those are, but there are a couple of sort of software programs that are available, I think mostly for purchase or subscription, that are being used by a few pantries right now. Mark Samborski, you have your hand up. Did you want to ask a question?
I just wanted to make a comment. I ran a food pantry for 4 years north of the river here in Kansas City, Missouri, in the Liberty area. And tears were brought to my eyes several times when I heard the testimony of these individuals and the work that they've been doing. And I still carry a lot of memories of those experiences. Now I find myself as an urban gardener, urban farmer, and some of it had to do with the discoveries I made at the food pantry concerning what kind of food was available when people are relying upon charity and contributions and whatnot. Was most of the year was nothing good at all for most of the people. And I almost felt guilty giving them some of the food because I was seeing them every week and I could see their health deteriorating rather than getting more vigorous. And there was a lot of addiction. I call it addiction because they knew what they wanted more for what was taking place in their body than really being fed good nutrition. The same time I was running that food pantry, I planted 200 tomato plants there on the church property. And they didn't know, most of the people did not know what to do with real food either. So there was a big challenge there in getting people to eat good food when what charity had provided for years continued to feed them in a way. So that's just some comments, plenty of observations and plenty of heartstrings attached to the people that are serving in that capacity. But it's a real challenge to create an atmosphere for the farmer that benefits when food is free. And that's something that we're experiencing as urban farmers in Kansas City right now. And thank you for your ear.
Yeah, Mark, I think you bring up some really great points of people are just so connected to the work that they're doing that they invest everything that they have. And it's often extractive in that sense. What do they have feeding into it? And you also brought up this idea of urban farming and urban agriculture, and how do we connect those systems in a way that not only feeds the individuals in our communities, but also ensures financial viability moving forward for farmers. And I know there was a symposium here recently where that was a huge bit of conversation when I presented on food pantry utilization, COVID, and really how do we see this as an opportunity to start connecting farmers and producers to the pantries, but also valuing the work that they're doing and the food that they're providing, and not just calling on them to give everything that they're producing.
Excellent. Thank you for that, Mark and Darren. There's a comment here that notes how food pantries in Missouri how the pantry distributes food is also influenced by the county sanitarian. So that is true. Food pantries do come under local health jurisdictions and may be subject to inspections and things like that. There is another question here below that. How would the distribution system and our communities change if there were more input from the food pantry clients and their involvement in the process and decisions? I avoid the other way of asking, how can pantry directors come to understand the realities of their clients' lives?
Yeah, I think that's a really great way to think about that as well. Like, how do we include client voice within the structuring of these organizations? I think that's a great way to approach it. And it comes from giving them opportunity to have input, opportunity for feedback, opportunity for input on the types of food, if pantries are going out and purchasing food, which I know some do, the types of food that they purchase, and really having that feedback loop, that dialogue, that communication is really important. I think there's a lot of empathy that can take place, a lot of understanding that can take place through the development and channels of conversation. But within your statement as well, I don't think it also should come at a request for clients to give up a lot of more information if they don't want to about their lives. And so looking at it, how can we change this approach from a top down by providing opportunity for voice rather than making it, once again, extractive of the clients and providing that input and requiring it, I think is really important. And there's some pantries that are doing a really good job and really highlighting our client input. But it's also, I think, an issue in how that halo effect, this idea of food is food, you should be happy for what you're given, type of mentality that's overarching. And I think it's necessary and needed, but the way in which it can be implemented, I think, has to be fluid in a way, when we start thinking about how we connect with directors and really how much more can we place upon them when they're already overburdened with operating these programs in their communities.
There was a second part to Joe's question about avenues for Missouri food pantry directors to network together. And Darren, I might just take this one. I've had a program called Power Up Your Pantry that's been grant funded, that's hosted webinars and created opportunities for food pantry directors to learn and get to know one another. However, I've also learned during that time and through this research through our center that the regional food banks quite often will host regional meetings and have, in my estimation, seem to kind of see a lot of value in helping their food pantry directors get together, share concerns, opportunities. And as Darren mentioned in related to his research, finding ways to just connect with one another, talk, and be of support to one another in those ways. So I would say that primarily that's happening presently through the regional food banks, helping to convene those groups.
I would be interested in talking to people in other parts of the state. I work I've been on the Harvesters Advisory Council, so I've had those networks, but I'd like to see what other people in the state are actually doing. So I'll touch base with you and see who I can connect with.
That sounds great. Juan has a question. Are there plans to use all of this information to develop a standardized game plan to prepare food pantries for future emergencies?
I hope so. I don't know that anyone is currently working on it. I think there's been the approach to addressing COVID has really been spread out when it comes to different health departments, being a more local kind of engagement. I'm really deciding on how some of this emergency response is rolled out. There's a need for understanding best practices, how food pantries could really set up their operations, the type of procedural things that they could be looking at. But as far as a standardized report, I don't know of anything that's being done personally, but I really think there is a great opportunity for it. I know that the food pantries that had the best kind of handle on how to address it, the expectations moving forward, were the ones that had the most amount of input from both their food bank region and the food banks that were reaching out, and also had a working relationship with their health departments in their communities. And most of the time that was spurred on by pantry directors reaching out to the health department directly and not the other way around. But having those connections, having that input, that dialogue in place was one of the key components of successful engagement. And not only that, but quick pivoting when it comes to food pantry operations. Some of them they never shut down. They were able to make decisions overnight, transition overnight from a client choice model in some of these places to a full drive-through model. but it was largely dependent upon those connections that they had.
Next question in the queue from Jeannie. Do you have any comments on the USDA Farmers to Families Food Box program as a response to COVID?
From my conversations with food pantry directors, to quote one of them, is there's food everywhere. People were just inundated when it came to food during the pandemic, especially when Farmers to Families started rolling out. Organizations everywhere were providing food. And one of the things that was an issue at some food pantries is being able to store and keep that food until their distribution. So there was a breakdown in kind of the ability to operate that program. And a lot of food pantry directors chose not to do it just because there was other agencies in their communities operating those, and they just didn't have the infrastructure to take in that added produce, which is a major concern structurally. When we're thinking about infrastructure of food pantries, having adequate cooler space, not just freezer space, but cooler space to store vegetables. A lot of places just don't have it. And that ended up being one of the things we were hearing from food pantry directors, is it was a great blessing, but also provided some barriers to implementation for some as well.
And everyone, I just put a link in the chat that takes you to an evaluation of that program that was conducted by the National Sustainable Agriculture Coalition. Has some really good insights about what worked and what didn't work in their estimation. So I would encourage folks to check that out. Next question from Steve Hennis. Director role strikes me as pivotal to pantry operations. Individuals often wearing many hats. Has continuity been a challenge, and have any pantries used shared leadership models to spread the work?
In most of the places we had conversations within our focus groups, there was definitely a defined leadership structure with one person taking on the majority of the leadership roles. I think there's opportunity for shared leadership models to really spread out that work, but one of the main issues I would say in it actually coming to fruition is most of these positions aren't paid. And I would advocate that we have a need to start having opportunities for financial incentive for individuals that are operating food pantries, and really starting to value the time and effort and work that they put into the work that they're doing. How that comes about, I don't know. It's kind of a really great question, but I do think it is something that's necessary within emergency food systems to not ask people to give up everything without financial incentive. So I would love to see pantries have more input and more support and that shared structure. And I think some of the directors would like some help at times, but if that comes to fruition, I think there's going to have to be a lot in place that really changes that.
Darren, you kind of preempted a question that I had, and I don't even know if it's a question or a thought, but like you talked about the emotional toll and the physical toll, and really the system seems pretty tenuous when you consider that and impact of COVID, and the fact that most people are volunteers, and just what are the alternatives? I think it is a very sort of vital food source for a lot of people. but it's also very tenuous.
Yeah, it's definitely a system that always seems to be teetering um, on a fine point of how it's working. And I always wonder what the system would look like if if individuals were continually trying to work themselves out of jobs within emergency food systems. Because given our definition of food security, even if households have enough of what they need to meet their household food need, if they're using food pantries, that's not a socially acceptable food source when it comes to our definition of food security. So I think there is this need to reframe and start thinking about the work that we do, and how do we not just meet need currently, but how do we start working to address some of the larger structural issues, and really try to work ourselves out of jobs as emergency food system workers, as social scientists studying emergency food. I'd love to not have to do research anymore on food pantries and emergency food utilization. And I often think of the end goal of my work is hopefully that we begin to continue to move closer to not needing this resource.
We have 3 minutes left until 4:30 if we're going to stay on time. So there's time for another question or two. Mark, did you have another question?
Just a comment concerning in the food deserts. We have been meeting some of that need through working with the Mennonite, Amish communities, the farming communities outside the city, still local, and just seeing a real connection between their sustainable lives and a lot of the city's unsustainable lives. And just the introduction of new and close cultures who are thriving in days like we are facing right now versus cultures who are living in fear and in uncertainty, a lot because of food. And just wanted to make that comment. Thank you.
Thank you, Mark. Jeannie has a question, Darren. What's Darren's biggest takeaway message for us?
I'm going to stick with my sociological answer that I put to everything is it's complicated. But no, I think it's a really good point of what's the biggest takeaway. And I think the biggest takeaway is that COVID-19 has really placed a strain, not only on emergency food systems and households on a larger scale, but within communities, within individuals. It's been hard. It's been really hard for people to take on that added stress, the added strain, and also find ways to meet need in communities. But I also think there's been a lot of efforts to think creatively and outside the box to meet those needs. We had food pantry directors learning how to use Facebook and post YouTube videos about how to use their drive-through that had never done it before. And so I think it's imperative that we understand the pressure that's been put on this system, but also the really bright spots within this system to think creatively to meet the need in our communities. I think there's some resiliency there within food pantry operations that really could be the crux to figuring out a way to improve these food distribution models and emergency foods as a whole.
Thanks for that, Darren. It looks like Jeff snuck in a question too. And we are at 4:30, so I do want to be sort of aware of the time. Darren, if you have a couple more minutes, we can answer these last two questions. But by all means, if folks need to move on with your afternoon, we certainly appreciate you being here for this presentation and discussion, and do want to remind folks that our center, along with the MU Extension team, are hosting Shoshana Inwood on March 18th to talk about emergency planning, disaster management, and how all of that fits into the food system. So we have a little kind of prelude to that topic here today. And then on April 15th, Michelle Miller from the University of Wisconsin-Madison will be talking about supply chains and how supply chains have been impacted by COVID-19. So with that, we will officially close the sort of formal official part of the webinar. We appreciate you being here. Darren, thank you for hanging on, and folks are welcome to hang on to kind of finish out this discussion, but we will wrap up probably in the next 4 minutes. So thanks, everybody. Darren, back to the questions, and thanks for taking an extra couple of minutes here. Jeff is curious about opportunities to use the space for partnering organization to set up booths, educational opportunities, ways to interact with folks in that way.
Yeah, it's a really interesting point that, I mean, pantries are still operating. They are still doing distributions, and we still can think creatively about how to engage with individuals that are going to these pantries, whether that be setting up booths, like you were saying, and offering a point of connection while they're in a drive-through pantry line. I will say that our team is also having a hard time thinking about how do we engage within these spaces to not put additional pressure on the pantry, but on the clients from potential increased exposure. And so I think personal protective equipment and personal protective measures are going to be really critical in thinking about how you can engage within those settings. But I think we need to start thinking about that because people need additional services that are going to food pantries, and we can find ways to continue to engage. I think it's just going to take that creativity that we've also seen within pantries. And I know some of them are still transitioning as much as they can back to inside if possible. With this type of weather we've been having, drive-throughs are hard. They are really hard on volunteers, they're hard on clients, and there's still a need for food. So yeah, there's still those challenges, but I think there's ways to think about that.
And then also Maria put in a comment and question kind of related to the irony of the US having one of the highest levels of volunteers and philanthropy, and yet how this has also created, or we find ourselves with this very sort of fragmented social services sector. Do you have thoughts on that?
Yeah, coming from social services myself, before grad school, I worked in service provision for individuals with mental illness and developmental disabilities. And Maria's right, like this is a very fragmented system, not only within the food system, but also in larger social services. And the lack of continuity makes it really hard for individuals to get the services they need, and that would support them for really key changes or critical changes to their lives that would really provide greater levels of stability and opportunity. And it's really concerning whenever you start working with people that get disheartened for even applying for food stamps. I would sit for hours with individuals at local offices trying to apply for SNAP benefits, and just to not be able to get in, or they would mail in their applications. And I talked with one office who told me at the time that most of the applications that they had mailed in were not reviewed, which is really concerning. But I think if we start looking more holistically at these systems and how they can work together as a more cohesive unit and provide a stronger safety net for individuals, I think we'll start seeing really great strides in our communities and the state and as our nation as a whole when people have the things they need to live happy, healthy lives.
All right. Thanks for hanging on, Darren.
Of course. Thank you for everyone else for hanging on.
We appreciate your time and your expertise. And thanks to everyone who was here today. Please do keep us in mind for March 18th. I think that will be a great presentation and discussion as well. And until then, have a great rest of your week and a great weekend.